Hi everybody, my name is Swati Maan. I'm a dentist and my topic for you today is the bad breath, also called as halitosis. This is a very common problem and we all might have experienced that in our lifetime. So my today's video is about giving you a checklist to know what could be the reasons for the bad breath and what can you do to rectify that. It's nothing to worry because in majority of the cases this is not very serious. So let's have a look and see. So the most common and the most obvious factor for the bad breath is inadequate oral hygiene. That means to say, if you're not brushing your teeth twice a day, if you're not flossing regularly, if you're not seeing your dentist regularly for a scale and a polish, then of course the food particles, plaque and tartar, they are responsible for giving you the bad breath you might be facing. Number two reason is the gum disease. If you have sore, red, bleeding gums and you feel like whenever you brush your teeth, you spit blood, there could be infection in your gums, which could be responsible for giving rise to bad breath. Number three is the dirty tongue. So if you're brushing your teeth regularly, you're flossing regularly, your oral hygiene is 5-star, but still you feel that now my tongue is looking yellow or discolored, then possibly the food particles are getting entrapped on the tongue and it's giving rise to the bad breath now. So a good use of a tongue cleaner after brushing your teeth regularly will rectify the problem. Number four, dry mouth, which we sometimes ignore and we don't really know about it. The dry mouth is when you find that your mouth is slightly dry because your saliva is a natural protection for your mouth. And if there is a less amount of saliva, lots of bad bacteria, they harbor inside your mouth and your gum surface. And they're also responsible for giving rise to the bad breath. So if you feel that your mouth feels dry, your lips feel dry, it's very important to start having a regular intake of water and fluid, which of course will help you. But of course, the most important factor will be speaking to your dentist. But if you believe that your oral hygiene is great and you do not fit in any of the other criteria, and your dentist has confirmed the same as well, then my suggestion will be to speak to your medical health professional because some of the medical problems can also give rise to bad breath. For example, sinusitis or a blocked nose. So that means to say you're not able to breathe properly with your nose because of the sinusitis or the blocked nose, and you're keeping your mouth open, especially while you're sleeping, to breathe properly. That, of course, gives rise to dry mouth, some gum infection, and leading to the bad breath that you're facing right now. So it's good to speak to your doctor about that. In children, tonsillitis is one of the reasons for the bad breath too. So if your child is brushing really well, but still you feel that the child has a bad breath and a sore throat, it's good to check with the physician about that. Infection of the lungs, bronchitis, infection in the digestive tract or the stomach. So if you have a bad stomach plus you have a bad breath and this has been going on for a while, it's always good to get it checked by the doctor. The liver disorder, diabetes is also responsible for the bad breath you might be facing. So as I was saying, there could be some medical reasons which could be associated with the problem that you might be facing right now. So it's always good to get the right treatment if you feel any of the factors could be responsible for your bad breath. So yeah, this was my video about the bad breath. As I always say, if you have any questions, feel free to drop me your questions in the message or the comment section, and I will try and get back to you as soon as I can. Again, I thank you for watching my video. If you like my channel, please subscribe because I'm going to bring more information, more informative videos for you about the oral health. So have a lovely day, everybody, and I'll see you in my next video. Thank you again.